No one knows precisely how these psychiatric medications act.
We don't know if I give you a medication if it is going to work or not.
There's not a great deal of scientific support for using them.
I myself, I try to pick a drug whose side effects might be useful.
You have to choose what is the best option.
We don't have sure methods.
There are no rules. Everything it's an art, really.
I would say it's a trial and error.
Often it's trial and error.
It's a kind of a trial and error.
It's trial and error.
Some degree of trial and error, I guess.
You never know if it's the right drug.
It's a much more complex subject.
There's always going to be huge surprises, and that's what makes it so difficult. The best psychiatrists in the world will mess up all the time.
The American public is being treated as a mass medical experiment. We are all being treated like guinea pigs by the pharmaceutical companies, the psychiatric industry, and the FDA.
They are basically testing drugs on large parts of the population without really knowing what the results are going to be.
It's a very dire situation that we're facing. We're talking about people's health and in many situations people's lives. These are very serious issues.
抗精神薬は危険な化合物として世界中の政府機関によって厳しく規制されています。新しい抗精神薬が使用を認可されるには市民を保護する目的による薬物試験を経なければなりません。
When a pharmaceutical company develops a new drug that they want to send to the market, what they do is they have to run it through clinical trials. They have to be able to provide to the FDA safety data to say this is a safe and effective drug.
In clinical trials, psychiatrists are engaged to do the research. And we could bank on the fact that these psychiatrists are tied to the pharmaceutical companies.
And the psychiatrist puts their name on there, they're seen as an expert. You're talking mental drugs, who writes them? It's psychiatrists. So that's how it works. It's a terrible system.
The desperate thing about it is that it's all dressed up in the name of science. It's not science at all, it's pure marketing. But they get away with it because it's called science.
There's really no test, no X-ray, there's no chemistry that shows you have this condition. It's really just the opinion of someone who is probably taking money from pharmaceutical companies to prescribe drugs to people.
Where's the biochemistry? Where's the research? Where's the substantiation? And the answer is it vaporizes like mist in the morning. It's not there.
しかし、科学的な試験手段が欠けているにもかかわらず、精神科医は危険な薬物の臨床試験をやめようとはしません。臨床試験には4段階の厳密な科学的薬品試験が含まれることになっています。はじめの3つは規制当局の認可を得るために政府に提出されなければなりません。第1段階では薬品の毒性をチェックし、第2段階では薬品が人体の中でどう反応するかを見る試験が実施され、このハードルを超えたら第3段階の試験が行われます。しかし実験室での試験では精神障害を確認も測定もできず、巨額の金がかかっているため精神薬の調査は極めて主観的であり、不正な操作がはびこっています。
There are many places where you can tweak the study just a little bit with the study design or with the way you gather the data or the way the data are reported, and there's so many different ways you could bias a study.
I've seen what they did to the data in these trials. There's no question that they manipulated the data.
For example, let's say they had 100 people to start with. 40% drop out. 30% have a positive response. 30% have no response. They then say that they have a 50% response rate, when in fact, most of us would say it's a 30% response rate because only 30 out of the original 100 really responded. And so you can see that that's a little bit of a manipulation of the research data.
When they design drug studies, they're only looking at the one thing they want to see. And they don't report all the other things that are happening.
典型的な例は抗うつ剤のシンバルタです。
Lilly, I believe, in February of 2004, did a clinical trial study. The people in this clinical trial did not have symptoms of depression. And in that clinical trial, there were 11 attempted suicides and 4 suicides completed. One of which was Tracy Johnson, 19-year-old college girl. She did not have any symptoms of depression, and yet this drug pushed her to commit suicide by hanging herself.
that shoots the theory down that they say that, people get suicidal because of the, underlying illness that people kill themselves, that these weren't suicidal people to begin with. These weren't depressed at all. These were healthy people.
それに続いてマスコミが大々的に報じましたが、 FDA 薬品評価委員会の精神科医たちはこの死亡例を無視することに決め、続く8月にはシンバルタの認可へと進みました。
One of the reasons why we have underestimated the potential of some psychiatric antidepressant drugs to actually trigger a suicidal kind of behavior in people is because the people who designed the research study didn't include in the research questionnaire the suicidal behavior. And then you can report that we had 0 incidents of this type of behavior among our subjects.
And then the response is trumpeted as if there's something magical about it, when in fact what's happened is a whole statistical tap dance routine that violates good science. However, on the basis of that kind of phony trial, the drug can be marketed.
Keep in mind that when a drug is tested in the clinical trials, it's only a very short period of time. The final phase of testing can be anywhere from 5 to 6 weeks.
The longest of those studies was 8 weeks. The shortest was 4 weeks. So these are not long-term studies. I think most physicians and most people taking the drugs assume they're long-term, 1 year, 2 years, 3 year studies. They're not. They're very, very short studies.
I find it pretty outrageous that we can base a multi-billion-dollar industry on a few 6 or 8 week clinical trials where antidepressant medications beat a sugar pill by a few percentage points.
このような偏った調査に基づき、致命的な副作用の可能性がある抗精神薬が FDA の委員たちによって日常的に認可され、生涯にわたって使用できるようになっています。どうしてこんなことが？医薬品が巨額の利益を生むからです。そして FDA の委員はそれらを認可することで利益を得る人によって占められています。
The FDA panels that evaluate these drugs are largely psychiatrists. All of a sudden you discover there are 20 different pharmaceutical companies paying them, either grants or honorary or some other way. They're getting paid by the pharmaceutical industry.
If you have a psychiatrist who works at the FDA, he could also be being paid by industry. He might sit on industry panels or discussions or get paid to be a speaker. What I found in working with physicians at the FDA was that they could have dual positions. They could sit on an industry board. They could be influenced by industry.
Many of them, the drug manufacturer actually proposes to the FDA, we would like this and this and this person to be on the committee. After all, they're the renowned expert. Well, of course, they're the, quote, expert in a particular drug because they're the one who the drug manufacturer paid to do the very drug study.
Have you been diagnosed with depression and struggle with sadness, trouble sleeping, anxiety, or low energy? Ask your doctor about Effexor XR.
第3段階の認可により、当然ながら猛烈な販売戦略が開始されます。しかし精神科医たちはすでにこれらの薬品を世界中で宣伝し処方し始めていますが、まだ行われていない段階がもう一つあるのです。第4段階です。
What phase 4 clinical trials are is when they've actually gotten the drug approved and then they get it into the general population so that we finally find out what it does when it hits ethnic populations, women, children.
Then we see who dies, who has seizures, who has deformed children, who has epilepsy, who has diseases downstream, whose heart stops.
The public is the clinical trial. That's where we find out the problems with these drugs.
This is an experimental stage, and it's so much so that one consumer protection group has advised patients that they refuse a prescription for any drug that hasn't already been on the market for 7 years.
So if you're taking a drug that's only been out for a year or 2 or 3, you are a guinea pig.
実験はこれで終わりではありません。精神薬の追加の試験は精神医療の診断統計マニュアルにある作り出された障害を利用して最も弱い立場にいる者に標的を定めることでさらに多くの利益をかき集めるためなのです。
If they test their drugs on children, then they get a 6-month extension on their exclusivity period or patent period.
テキサス州にあるこの精神医薬調査センターは広告を使って子供のボランティアを誘い込んでいます。中に入ると極めて単純な仕掛けでさらに誘惑されます。
This is where they're going to be playing. We have Game Boys, we have Xbox, we have 5 TVs.
They come in here and they help themselves to crackers, cookies, free candy, free crackers.
Everything is paid for. You don't pay for anything.
しかしこうした特典は同年代の子供たちに自殺や暴力を引き起こすことが知られている強力な精神医薬を彼らに摂取させるためのおとりに過ぎません。
These are drugs that would cost maybe several $100s a month in a pharmacy. They actually are getting them free in research.
We love children, and we just love children because they're our future.
By conducting those tests on children, they get a financial incentive that's worth over $1 billion. Those are the facts. You make of them what you will.
これほどの利益がかかっているので子供たちに対する精神医薬の実験がはびこっています。調査済みか調査中の研究が323件あり、中には月経前不機嫌性障害を治療する抗うつ剤に関して子供たちをテストした2003年の実験もあります。
Those drugs which are barely more effective than placebos often have huge side effects which are dangerous and even deadly to people.
Families don't know the risk. If they actually were aware of the risk and believed it, no one would take that risk.
The psychiatrist she didn't say one word to me about what was going to be the effects of the drugs.
No side effects listed, no. Well, let's sit down, we have to talk about this. At that point in time, he said, well, this doesn't have that type of reaction on any children, that it's very safe.
If he had told me then what I know now about it, I never would have taken it.
She said, Beth must have been on Paxil. That's the only way she would kill herself. And I said, well, what is this? How do people know this? I didn't know anybody would know something like that. And we went on the internet, and all of a sudden you find out it's not uncommon. But it's not uncommon for people to become psychotic on these drugs.
We're entitled to know the truth before we give a mind-altering drug to our children, our wife, our mother, our father, ourselves.
We don't really know what they're doing. That's what scares me. It's all made-up theory. There are no facts about what these drugs really do. And if someone said, well, we don't know what this is going to do to you, good or bad, would you take that medication?
Now that is not the practice of medicine. That's the practice of marketing. And this practice of marketing is taking lives. And the poor patient doesn't even know it.
しかし向精神薬のテストと販売戦略においては金のために安全性が踏みつけにされています。最も処方されている精神医薬トップ10の売上合計は年間265億ドルを超え、合衆国造幣局から毎年発行される新しい貨幣総額の2倍以上です。しかしこれだけの金を作るためには精神科医たちはまず市場における最も重要な部分を納得させなければなりません。つまり処方する権限を持つ人々です。